name is Possibility and this is Dr. Ramsaksha. Today I am here again to talk about scorpion sting management on various aspects of the scorpion sting. Today I am going to discuss. This is one of the common presentation that we see in ICU or emergency, especially when patient is coming from rural background in the Indian scenario. Scorpion sting causes envenomation of the patient, and the toxins of the scorpion sting contains various complex compounds. Among all complex compounds, the small peptides called alpha toxins or plays crucial role in the pathophysiology, or these are the toxins which can cause all possible effects and which can affect all the organs in the human body. Alpha toxins are 61 to 76 polypeptides, and it affects voltage gated sodium channels. It inhibits inactivation of the channel. That means overactivation of the sodium channels results in prolonged depolarization and neuronal excitation. These toxins will affect both sympathetic and parasympathetic nervous systems. Among sympathetic and parasympathetic, the excitation of sympathetic nervous system will be more than excitation of parasympathetic nervous system. The other toxins in the mixture can act on potassium and calcium channels. Because of excessive stimulation of sympathetic nervous system, uh, that will result in excessive secretion of all catecholamines, epinephrine, norepinephrine, and other vasoactive peptide hormones, especially neuropeptide Y and endothelin 1. So these are all hormones or mixture of the hormones behind all pathophysiological features, or behind all effects of the toxins, especially cardiovascular effects. It affects all the systems in the body, initially cardiovascular system and neuromuscular system, especially peripheral nervous system. It will affect. It will not involve central nervous system and GIT respiratory systems. What are the local effects of toxins? Like any other sting, any other bite, it causes local erythema, paresthesia. Muscle fasciculation is because of neuronal stimulation of the peripheral nerves. Excessive activation will result in fasciculation of local muscles. Numbness at the site of sting. So if patient ignores these effects, it can cause cellulitis or rhabdomyolysis. That itself can cause acute kidney injury and renal failure. Coming to other features, excessive stimulation of the parasympathetic nervous system results in hypersalivation, profuse diaphoresis, lacrimation, meiosis, diarrhea, vomiting, hypotension, bradycardia, and increased respiratory secretions. These are all symptoms or signs similar to OP poisoning. Stimulation of sympathetic nervous system causes hypertension, tachycardia, mydriasis, hyperthermia, hyperglycemia, agitation, and restlessness. Coming to cardiovascular system, because of excessive release of catecholamines, it causes hypertension and hypertensive heart failure. And these toxins directly can act on myocardium, can result in myocarditis, and they can cause pulmonary vasoconstriction. All these factors together results in myocardial dysfunction and myocardial depression and can cause cardiogenic shock. Other main pathognomonic feature is excessive or increased systemic vascular resistance. This itself can cause decompensation of the heart. So whatever modalities we start on these patients, those modalities should able to decrease the systemic vascular resistance, should able to increase the myocardial function. Coming to neurological manifestations, it causes uncoordinated movements and fasciculation of the muscles because of stimulation of or excessive stimulation of the peripheral nerves. GIT can cause severe pain, diarrhea, and pancreatitis is one of the feature of scorpion sting. Other effects, it can cause hemolysis, hemoglobinuria, and these effects can result in acute kidney injury. How can we manage a patient? Analgesia to control local pain and local inflammation, local anesthesia to decrease the pain, and all these factors will decrease the heart rate and load on the heart. Other organ support, if the patient is in respiratory failure because of the pulmonary edema or because of the respiratory muscle involvement, may require invasive ventilation. If patient having AKI may require dialysis support. Cardiovascular, to improve the myocardial function, we should start them on dobutamine infusion. And to decrease systemic vascular resistance, prazosin is the drug of choice. The dose of prazosin is 0.5 mg third hourly per hour. NTG infusion can be started to decrease the systemic vascular resistance, to decrease the agitation of the patient, and to decrease those peripheral nervous system signs like excessive stimulation of the muscles with the help of benzodiazepines. So these are the different modalities to treat the scorpion sting. Okay, thank you very much, and we'll meet up soon.